Let's learn something really quick.
If you got the time, absolutely. And you got the discipline, there's no question about it.
I love that. Yeah, that's a great practice to put into your everyday life, you guys.
You generally regret the things you don't do, not the things you did do. Let me say it that way.
Mic drop. This was just awesome. I love meeting my guests in person, and it's a whole nother animal, and the energy is just electric. You guys, this is your host, Deanna Radulescu with Label Free Podcast. To live your best life, you must live label free. What is good, everyone? This is your host, Deanna Radulescu with Label Free Podcast. To live your best life, you must live label free. As always, bring incredible guests from all over the world, so sit back, relax, and tune in. My next guest is a PhD-prepared ICU nurse with extensive training and experience with health, wellness, fitness, and anti-aging, my favorite. Her areas of expertise include metabolic health, supplementation, and use of alternative therapies to enhance cellular health. Please welcome Dr. Christine Boev. Dr. Christine, welcome to the show.
Thanks, Deanna. Thanks so much for having me. I'm excited about this conversation.
Oh my gosh, me too. Like, this is one of my favorite things to talk about. Number one, even though we have all these resources out there, people still think that there's like a quick fix to health. There's a quick fix to anti-aging. There's like this quick fix. They want to jump on the bandwagon of all these different things. And that's really not the case. So I want you to share with us kind of like why you got into this area of expertise and how you can help people that you work with.
Absolutely. So I've always been healthy and athletic. And like many of you, when I turned like 42, so I'm about to be 50 for context. When I turned 42, and it just started to gain weight, I couldn't keep it off. I did every diet, every cleanse, all the things, right? And nothing helped. So I used my expertise, my role as a scientist, as a PhD prepared nurse, and I started doing my research. And I developed my own protocol that involves strength training, protein, mindset. And really it's about the mindset, right? I can tell you what to do, but if you don't do it, it's not gonna help. I got rid of the 20 pounds that I was lugging around with myself and really transformed my health to the point where I'm 50, but I feel like I'm continually being reborn, reimagined. And I just want all women to know that menopause isn't the end. It's really the beginning.
Yeah. And for those of you that are listening, you got to check out this smoke show because she does not look anywhere close to 50. We should all aspire to look like this at this point in our lives. So I'm 48. I talk about my age all the time. I have no problem with it because, I'm proud of where I'm at. I've always trained lifted weights. I have not had a period in like 6 months. I work out, but I am noticing like my body changing a little bit. And it's frustrating for someone that has taken care of herself for so long. I am big into supplementation. I do my protein, I do my collagen coffee every morning. Like I my diet is fairly clean. Obviously we have days that, we indulge a little bit, but it's wild to see your body change the way that it does at this point in your life when you've taken such good care of it.
Yeah. I love that you're prioritizing strength training because muscle is our organ of youth. It's going to keep you more metabolic. The more muscle you have on your frame, the more efficiently you're going to burn calories. Yeah. So that's what women that are in their 40s and beyond really need to focus on. You go to the gym and you see the same people on the elliptical or nobody, and they look the same, right? Like they don't look any different. And I just want to be like, sister, come on, like get off that thing. Let me show you. Like, it's not that hard, but you've got to be super disciplined and super consistent. Otherwise, the changes in your hormones do creep up with you. And then all of a sudden you look down at your midsection and you're like, what the hell happened? And it can get really discouraging after a while.
Yeah, for sure. I'm a former personal trainer. I used to train and I worked at the Exercise Coach. I'm not sure if you're familiar. I don't know if they're around anymore. But I worked with a lot of women in their 60s that never lifted weights, and they had a doctor prescribed workout regimen to lift weights because they had such bad osteoporosis. I know just from my past, like we're training like friends, family, and different people, women still have this idea in their head that if they lift weights, they're going to get massive. And it's just like you have to take so many drugs, number one, to get that big unless you have some crazy alien genetics that's going to make you get big by lifting. Like I lift very heavy. I'm pretty strong for a woman, sorry. but I love it. Like, I want to be strong.
Yeah, I love that. Like, I am statement, right? I am athletic. I am strong. And it's impossible to look like a bulky bodybuilder if you are not training with somebody who's preparing you for some sort of show on a stage. So ladies, don't worry about that. Your body wants to put muscle on, but there's this big word, it's called sarcopenia. And it's muscle loss as you get older.
Oh, yeah.
And in your 30s and 40s, your body is just getting rid of muscle, which means you are going to have chronic disease and you're going to age really poorly. So get in there, pick up the weights, pick up the heavy weights, like Deanna say, because that's the magic. It's the strength training plus the protein, like you were talking about. And as you get older, your protein needs are so much more than you even think they are. And I love that you take collagen because collagen is a no-brainer. Your skin looks amazing.
Thank you. I mean, it has so many benefits. So I take a lot of different things for my skin, the collagen, like you said, and just regular vitamins. Like I'm big into it. I do take creatine. I didn't take it for a while, but there's been a lot of research on creatine now that helps with your cognitive function. You know, it helps prevent dementia. And I mean, I've been taking it more regularly now, and I'm noticing the benefits. So do you take creatine too? Do you recommend that?
Absolutely. Yeah. So I take creatine every single day, even on days that you don't train, men and women, you want to take creatine because it gets into those muscle cells. Creatine is a no-brainer. It is the most highly studied. It is safe. You will not blow up on creatine. I'm about 140 pounds. So I take 2.5 grams every day. It's cheap. Like you said, it's a no-brainer. I don't want Alzheimer's and dementia. Like, wants to be, looking good, but your brain is broken. So there's so many benefits. To me, that's an easy one.
Yeah. Well, you had said something about strength training, and we lose muscle in our 30s and 40s. And it's just like, that is such a scary thought because we could lose our vitality if we're not taking care of our bodies. And I've had this conversation quite a bit with different guests, and it's like, at what point does someone want to help themselves to change their lifestyle so that they are able to be vital throughout their 60s, 70s, and even into their 80s?
Yeah, I mean, I don't think there's any, it's never too late, right? But the sooner it becomes part of your identity, part of who you are, the better your outcomes are going to be. Some of my clients, they're nervous to go into the gym. They think everybody's watching them. Guys, nobody's watching you, right? Everybody's just dialed into their own thing. And you just need to either work out at home or work out at the gym. You don't need a lot of equipment to get a really great workout in. And I think that's something that people need to recognize. But my parents are in their late 70s. I'm like, guys, get in there. My mom, she does old lady, strength training. And I'm like, keep going, Mom.
Good.
What? Osteoporosis. If you have broken bones, you are going to be extremely debilitated. So strength training strengthens your bones too. So there's just no downside to it.
Preaching to the choir here. And I think that if people would start taking an active role in just starting somewhere, even just doing body squats or push-ups, that can make such a difference. So if I'm so busy and I'm not able to get to the gym, I will take a minute. I'll do 3 sets of 100 squats, 20 push-ups, just something to get the blood flowing, to get just to make sure that I'm using my muscle, a body in motion stays in motion, right? That old saying is so relevant and it's so true.
And body weight is great. Or I take resistance bands with me when I travel. Those are great too. There's no excuse. You can get a great workout in with just a floor. There's really no reason to not do it.
So for your clients specifically that are maybe approaching menopause or in menopause, when they come to you, what is their common complaint?
It's very similar that I hear kind of on a repetitive pattern. I was always really healthy, and then I turned, late 30s, right? Early 40s. And I got this fat accumulation in my midsection. I feel like crap. My clothes don't fit. I have brain fog. I'm a psychopath part of the time. And the last thing I want to do is have sex with my husband. That's the common thing that I hear over and over again. And it doesn't have to be that way. That's the good news of all this is just because your ovaries are making estrogen anymore doesn't mean that you're dying.
Yeah.
There are so many things that we can do so that you feel youthful and vital and hot. And that's really important.
Absolutely. Heck yeah. I want to feel hot for as long as I can, damn it. I don't care what anybody says. And so do you have like a success story besides yourself? Like you're stunning, you're gorgeous, like you are a walking billboard for what you do for women. So I love that. I always think it's interesting when you go to the gym and these trainers are training people, but yet they don't look like they train themselves. Like that's not somebody I would work out with. I'm just saying. So a coach that like you that is like representing something to help women in this stage in their life, you are a billboard for what you do. Do you have a success story of someone that you've worked with, maybe like how they were when they came to you and after working with you, how they ended up like looking or feeling, you know, just the transformation that they went through?
Yeah, I mean, I have multiple and they're all on my Instagram, but the one that sticks out in particular is I have a client who I've been working with for a little bit over a year, and she came to me terrified, right? But very, very overweight. She was about 288 pounds. And we have worked together for the last year plus, and she had lost 100 pounds.
Wow.
Mom of four. She is a full-time working mom of four.
Yeah.
And we transformed her basement. It with, started with some dumbbells, and then, they got a cable system. And I mean, every holiday, new gym equipment shows up. And her I am statement is, I am a badass. I am an athlete. Where before her confidence was terrible. She's so proud of what she's been able to accomplish, and it's through discipline. She just never quits. And if you don't quit, I limit in terms of what's possible.
I love that. That's just amazing. Losing 100 pounds, that's like a person. You lost a whole person.
Well, and people come to me and they're like, well, I need to do this, and they want to do it in a month. And I'm like, there is nothing I'm going to be able to do for you in 1 month.
Yeah, right. Yeah.
You're undoing years of abuse to your body. So you've got to give it some time. I think being very patient through this process is critical, because if you don't look that different from 1 week to the next, it's the effect that, a month from now, you look at your photos and you're like, damn, look at that. Like it's working. And it is.
Yeah. I say this to my husband. I'm just like, when a holiday comes, you go to the gym, it's like everybody's at the gym. I'm like, they're coming. They're thinking this one day they're at the gym that they're going to lose 50 pounds or make a big difference. I just think it's funny like that. I mean, it's very common. It's very common. One of your questions here is you say something about Ozempic. And I know that is a pretty big thing these days. I actually took it for a little bit because I had an affiliate and they just sent it to me. And I'm like, sure, I'll try it. I like to eat. And I found that it wouldn't allow me to eat, and I didn't have a lot of strength. And so that just didn't work for me, So I didn't do it anymore. I was like, okay, I'll do it. I'll promote it with my code, whatever. I'm an affiliate for this service. And it was a very interesting experience. So do you have clients that come to you that have taken that?
I do. So I have a handful of clients right now who are on the different type of GLP-1 inhibitors. And I think the answer is it depends, right? Yeah. I have some clients, their body is very stubborn. And even if they've done all the right things and they're not technically diabetic, things don't budge. So if you're going to try any of these medications, you must work with somebody who is going to help you strength train and prioritize protein, because otherwise the weight that you're going to lose is muscle, and that is detrimental. So it's not a one size fits all. It's not a quick fix, because if you stop taking it, your appetite's going to kind of roar back. And if you haven't done the lifestyle modifications, then you're just going to regain the weight and you've lost precious muscle. So I think obesity is an epidemic that causes people to die. You're going to have cancer. You're going to have metabolic syndrome, like all of those things are terrible. Yeah. But we also have to figure out something that's sensible and sustainable. So I think it works for some people and it doesn't work for other people. But like you said, if you enjoy food and food repulses you, that's not really living.
I can see where it would help jumpstart someone's if they are in this place and they're having a hard time getting started, I could say what could jumpstart things for them. But I found when I took it that I had to force myself to work out, like find the energy to work out so that I would want to eat. And so for me personally, there was a delicate balance because like I don't have a problem with my meals and my consumption of food. I just had the opportunity. I'm like, why not? I'm getting it for free. Let me see what this is all about so I can speak on it, right? And so I did. I just found for me, like I prefer to have my energy. I want to have high energy levels. I enjoy food and I don't have a problem with food, but I can see where it would help someone jumpstart that lifestyle and get them on the right track. But you don't want to become dependent on it. You want to be able to kind of even out how you manage your food and just working out and stuff if you're going to take advantage of using that kind of therapy, whatever you want to call it.
Yeah, absolutely.
Christine, what does it look like if someone wants to work with you? So they reach out to you. How does that process look?
So I have a program. It's called Master Menopause, and you can go to mastermenopauseprogram.com and you can sign up. I also have a free training that kind of takes you through my style and what to expect when you join the team. But it's really me providing you with the roadmap of how you regain your vitality, your youthfulness. And it's really just through sensible, strategic nutrition and training. There's no magic. There's no recipe here that is off anything crazy, right? There's no potions, no cleanses. It's a lot of hard work, but it's so worth it.
Absolutely. I love that. Where else do they find you? So mastermenopause.com. You mentioned your social media. So can you plug your links really quick?
So Instagram, I'm Dr. Christine Boev, and LinkedIn, it's at Christine Boev. On my LinkedIn, I do a lot of scholarly articles related to health and wellness for the more kind of cerebral community that's looking for the research. I think that's important, right? You're doing things based on science, not based on like what you're reading in a newspaper.
Yeah, I totally agree. You guys, I'm going to put those links in the show notes. So if you connect with Christine and want to learn more, or if you know someone that might be approaching or dealing with this point in their lives and they're going through this transition and they need help, have them reach out to Christine, go follow her on social, give them the website. The links will be in the show description, the notes, whatever you want to call them. Christine, this is a part of the show where I like to ask for last words of wisdom or advice. What would you like to leave with us today?
50 is just the start for you guys, and you can reinvent yourself and reimagine who you're going to be and what you're going to look like as long as you take care of your body and your mind and your health. Sky's the limit in terms of what's possible.
Yes. That's called a mic drop right there. Okay. Never too late to change. Take control of your health, your vitality, and all that good stuff. Christine, thank you for sharing your expertise around a subject that I think is starting to get a little bit more highlight on, which I think is important, especially for women. So thank you very much for what you do and being with us today.
My pleasure. Thanks for having me.
You're welcome. You guys, this is your host, Deanna Radulescu with Label Free Podcast. To live your best life, you must live label free. As always, don't forget to subscribe, follow, rate, review, comment, share, all those good things. And I'll be back soon with more dynamic guests.